And I think maybe we should have you turn a little bit like this. Okay. Yeah. So the first thing that we're gonna do, and we'll kind of move in different directions so you guys can see with the protocol, is I'm gonna have her go ahead and move her neck around and just kind of notice where she has the most restriction. So where do you feel the most restriction? I see it there. Yeah. Okay. So I'm gonna make that my focus in this massage. Oh, we actually have there's a little bit of peppermint in this. Okay, so I'm gonna apply some oil, and you want to have a little more oil than you would normally use in a Swedish massage, definitely more than in a deep tissue, because we're gonna be protecting the skin with it. And we'll start with just some massage, just warming up the tissue. Do you like lighter, deeper pressure?
Usually deeper. I'm pretty. My back is pretty sore though.
Okay. Is that too much, or are you okay?
Right there is fine. Yeah. Okay.
Oh, this is the downside of a stool that rolls.
That's a spinning chair.
But the upside will be we can move in different directions. So you're gonna go ahead and just work with that muscle. And with this protocol, we're gonna spend at least 5 minutes on this area doing massage, but up to 10 minutes before we work with the Gua Sha tool. Stabilize you with my hand. Did your feet touch? Are your feet on the ground?
I'm short.
Do you want to go
My
lower?
toes touch.
We should make the stool lower. And then you can get your feet on the ground.
There.
Okay, perfect. And then you won't roll as easily. You're very mobile in the rolling stool when your feet are up. Are you doing okay with that pressure?
Mm-hmm.
Okay. I'm just warming up the tissue and noticing what's going on with her muscles. Okay. So now I'm going to choose a tool. I'm going to use a combination of a soup spoon and then this resin tool. And I'm going to use the soup spoon because that's what you guys have, so you can see it. So go ahead and move your neck around one more time. And yeah, I see that there's so much more restriction on this side, even though you feel it on both. So we'll go ahead and start where she has the most tension. Can you guys see that pulling? What's happening? So we'll go ahead and we'll start there. So you're welcome to, yeah, I'll come around. And I'm going to start with these little scraping motions. So if you're working with one of these board-like tools, Guasha boards, then you will work at a 45 to 65 degree angle, meaning this is 90, so you wouldn't be scraping like that. You're kind of turning it to the side, and there's a little scoop with it, so like a little scooping type thing. So go ahead and really stretch that and open that up, elongate it. And you guys can see immediately that it's starting. Can you see immediately? It doesn't take very long for that Sha to come out. If someone doesn't have, and I'm not pressing very hard, but if someone doesn't have that buildup of metabolic waste there, so say they've had a few Guasha sessions, or they just have good circulation through the area, they're not going to get this reaction at all. Because the Guasha tool is, and I see that surprise on your face, but it doesn't hurt, you know, and we're not trying to make that come out. The goal of Guasha is not to get these marks. It's actually to free fascial adhesions and to degranulate any metabolic waste that's in there so that it can be processed by the body and flush out. Okay. But when we use this smooth edge tool, we're not harming the skin, so there's nothing that's sensitive with the skin. It's the underlying tissue. And when we use this tool, we are pressing against that grainy, sandy texture of the metabolic waste, like the mast cells and stuff. And there's little capillaries and things like that in there. And so we get what's called capillary leakage. So the capillaries kind of break, but that's the thing that signals your body to go back in and repair all of this. So it's a really good thing that it's happening. And your client's able to process all of this, meaning they're able to move away from that chronic tension, and the body can start cleaning all that up because they're in a relaxed state. So, whereas normally if you had injury, you would not be in a relaxed state. So go ahead and stretch again. We'll look at all that. Yeah, you had a lot there.
Yeah.
Okay, go ahead and move your head around and tell me where you feel the most tension right now. Okay, so it shifted a little bit. Yeah, so go ahead and bring your chin to your chest, and we'll work with that along the spine. If you want to work directly on the spine, you need to be careful. You've got that 45 to 65 degree angle, and you can scrape along it, but you want to use where there's the divot in the tool so that you're protecting the spine and you can focus on the erector spinae with it. You will oftentimes get a little bit of Sha that will come out along the spine too, which is great because it's really hard to access and to degranulate and get circulation and, you know, into
What
that
about
area.
scar tissue?
What
about scar tissue?
It's great for scar tissue.
Going
It breaks
right
it,
over the scar
They can
tissue?
go right over it,
Directly
breaks down.
over it.
As long as the skin has integrity
Mm-hmm.
and isn't crepey skin,
Okay.
then you can
Cool.
use Gua Sha over scar tissue, and it's very helpful. It breaks it down, helps it rebuild in a healthier pattern. Okay, so you guys can see that it's coming out right there along the spine. And
And when you're coming back up, you're not pressing down, right?
I'm pressing kind of like a scooping, so it's not directly in, it's like in a little bit and then scooping it out. So scooping out.
So when you start back at the top, like you just lift it and take it.
Yeah, it's lifting
You're
every
not going
time.
back and forth.
Yeah, I'm not going back and forth like that. It's down, down and lift, down and lift. But it looks kind of like I'm scraping back and forth because we've got the return stroke, but these are just consistently down. Down and out is the direction I'm moving. Sorry, Sarah. I'm glad you're getting this. You're seeing a lot coming out. Scooping. So each time down and out, and your turn is not touching the body at all. And that's great. Great question. Okay, so then in between, I'm going to do a little bit of massage. Stabilize yourself. You can move all that tissue back. So we're working with some range of motion and stretching, and with massage, and then also with Guasha scraping in these treatments. A nice little trifecta of body work, those three things together. You've got some trigger points and stuff in there. Are you doing okay?
Yeah.
It's probably kind of intense. If it's too much, make sure and let me know, okay? Okay, let's have you move your neck around again and tell me where you're feeling the most tension now.
Probably this side a little bit,
Okay.
but
Right, which makes a lot of sense. So we'll have you go and turn. And you guys are welcome to also walk around and see close and see it.
Oh,
You're fine, you can. Yes?
well, I was trying to figure out what side you were using, this side or.
You could use either side. I actually, just for the shape of her body, I like this more rounded side. Okay, so we can see that petechia is starting, and then after that, the Sha starts to come out.
feels really good.
So in Vietnam, this is called Khao Kio. In Thailand, it's called Hek, with a similar style. And we have some techniques here in the West. Graston technique is one. It's the name of a company that utilizes Gua Sha and some of their own specific techniques. They've kind of added to it. And instrument-assisted soft tissue mobilization is another term that we use in the West. It's a very popular treatment. And then also one that you can use on clients when you're doing a more in-depth treatment like this, or you can use on yourself when you're doing the facial Gua Sha or just giving yourself a little bit of like spot treatment on your own neck.
Yeah, I've done my own neck and shoulder
Yeah.
before.
Have you ever done it for like kind of
So nice.
fasciitis or?
Yeah. And as massage therapist, I mean, I would be working on I do work on my arms every week, you know, to keep circulation moving through there so you can have healthy tissue.
So where it's like obviously like deeper and darker on this side, does that just mean there was more right there?
So most of this is bright, so compared to other Gua Sha marks I've seen. But if it is deeper and darker, then that's going to mean it's more chronic and it's been there longer. If it's bright red, that's usually more recent type granule buildup, you know, metabolic waste buildup. So it's a tool for treatment, but it's also a tool for assessment. We can see where there's been a lack of circulation and where the body needs to go back in and revisit that, repair it. So in addition to flushing out that metabolic waste, Gua Sha also causes the body to lay down hyaluronic acid and collagen. So that's why it's really great, the facial Gua Sha. It's a great alternative to Botox and fillers or addition, whatever, you know, but it's very helpful in keeping your skin youthful and healthy. And that feels nice. Not that those two things are synonymous, but it does help with both.
And could you use that all the way down the spine?
Yeah, and we will when she lays down. Okay, go ahead and bring your head up and just move your neck around and tell me what you're feeling. Does that feel a little more freed up?
Yeah.
Okay, so now I'm gonna have her go ahead and lie down in the middle, and I'll have you start face up.
Okay.
And I'm gonna do just a little bit of massage on the neck, and you can just keep that shimmy like that. So a little bit of massage on the neck, and a little bit of range of motion stuff. So just getting a little movement in this area. So I'm gonna slide my hands under, come on either side of C7, and just kind of press up with my fingertips. And just kind of traction. And get into those suboccipitals. And get a little bit of movement and everything. Move her head to one side. Just use flat knuckles to kind of do some little loops. Traction that shoulder down a little bit. Just so that her body is reminded of what it's like to be relaxed and what it's like to not hold tension. And I'll do the same thing on the other side. Making sure that the whole time that I'm using good body mechanics and that I'm making this easy for myself by making the movements yoga-like, so that my whole structure is supporting, you know, each movement. Even if I'm kneeling here, that my whole body is involved on some level in this, because then it's easy. And then as a therapist, it helps support you in becoming healthier and healthier, instead of starting a path to like decline and bad posture, hurting you, injury. right? Because that happens when we don't use our whole body as one unit, when we're not supported, when we're not using everything that's available to us. Then we get overuse injuries. I want to make this easy on ourselves, but good, meaningful work for our clients. I'm going pretty deep on you. Are you okay? Do you want?
Oh yeah, no, that's
Okay.
great.
If you do use your thumb, make sure it's supported. Keep the family together. Don't want a lot of that. Don't want this. And then make sure that you're not pressing in with your thumb like that, but that you're just leaning your body weight into each movement. Carrie knows this, having been a therapist for a lot of years. It's a game changer. Like, you will hurt yourself so fast if you're not using these supported movements. If you try to use what we call force, then you get pushed back and you get hurt.
And you don't stay in the profession. You don't take care of yourself.
Yeah. And taking care of yourself means working in a relaxed way. Like relaxed, supported way.
Use your body weight.
Yep. Use your body weight, use leverage. So I could spend a lot more time on her neck, and we'd both be happy, huh? Because it's actually meditation to work. You guys know this. It's like such a great meditation to work on someone. But in the interest of time, never turn just a second. If you want, you can kind of get some side to side movement, pressing in on either side, back and forth. Getting the body moving in every direction that you can. Okay. So, I'm gonna have you guys turn over, and then I'll just help rearrange the sheet.